Do you ever leak with sneezing, coughing, or laughing? Are you the person who runs into a building and immediately finds the nearest bathroom? Do you have pain with sex, vaginal pain, or are you recovering from a recent vaginal or cesarean delivery? If so, Women's Health Physical Therapy can help you. My name is Taylor and I am a therapist here at Steppin Physical Therapy, here to talk to you about women's health. Women's Health Physical Therapy is a realm within PT that deals with the pelvis and all the associated structures, including the pelvic floor, the bony pelvis, and the nerves that innervate the muscles of the pelvic floor. So to start off, I want to talk about what is the pelvic floor. So it quite literally is the floor of our trunk. So I have a model here showing the pelvic floor muscles. So this is the bony pelvis here. So like if you put your hands on your hips, that's what these bones are right here. And then the muscles that are here are shaped like a hammock or like a sling. And those are our pelvic floor muscles. And they provide 5 very important tasks to our body, sometimes referred to as the 5 S's. So they are sphincteric in nature, meaning that the muscles are circular and they contract to help hold in urine and bowel, and then relax to help with proper urination and bowel excretion. Then they are also supportive in nature, meaning that they support our internal organs and help keep everything where it should be. They are involved in sexual function. They are also a sump pump, so they help with fluid movement to make sure that there's not backup and congestion in the pelvis, and they also help with stabilization. The pelvic floor is actually one of the primary stabilizers of our lower back. So the pelvic floor and dysfunction in the pelvic floor can also cause lower back pain. In pelvic floor PT, we also talk about habits that need to be broken. So if you've ever heard of jicking before, that's what we call just in case peeing. So if you do this, you know what I'm talking about, where you're like, oh my gosh, I'm going to the store, I better pee just in case. Or I'm going to my son's baseball game, I better pee just in case, because what if there's not a bathroom? Or what if I can't get to one in time? So if that's something that you normally do, we'll talk about how that interrupts that relationship between the bladder and the pelvic floor and can lead to longer lasting deficits. We'll also talk about posture, breathing patterns, how those things impact our pelvic floor, as well as discuss habitual things that you can take care of pretty easily. It's usually just information that can lead to a lot of change. On top of that, we often do an internal assessment of the pelvic floor muscles, find areas that might be tight or areas that might be weak, and then address those accordingly with certain exercises and interventions. So if you have any questions or you're somebody who has dealt with these things, please know that it is so common, but that doesn't make it normal and you're not alone. So if you need to reach out to us, please call us at 260-497-7191 or stop into our locations. Again, I'm Taylor Shorgen, a physical therapist here at Steppin Up, and I look forward to chatting with you.